Hello, and welcome to the Undecided Health Careers information session. This information session is for students who know they want to go into a health career, but they aren't sure which one. During this seminar, I'll be going over the health career programs Oakton offers and some decision-making criteria you may want to use when considering your choice. Finally, I'll give you some resources, including how to make an appointment with a health career advisor in order to continue your decision-making. So let's get started. There are 16 health career programs available at Oakton, which you can see listed here. Some are short one-course certificates, and some are longer degree programs. Each have their own admission requirements and curriculum. Our 16 programs vary in scope and content. All our programs prepare students for a career upon graduation. Some are one-semester certificates, and others take up to 2.5 years because they are degree programs. Programs are housed at either the Des Plaines or Skokie campus, and some may be stackable, meaning you can earn a credential with a few courses, then build into another credential by taking additional courses on top of what you've already completed, or perhaps even transfer to a university for an advanced degree. So you see, the breadth and scope of Oakton's health career programs is vast, which is wonderful for variety, but may prove overwhelming if you're trying to find your place within the healthcare industry. First, celebrate the fact that you know you want a career in healthcare. That's a huge first step in your overall career development. But let's start thinking about the different parameters that go into fine-tuning that decision and help you narrow down your choices even further. We'll go through some criteria that may help you narrow down your choice. Now, not every criteria that I'm going to talk about will be important to you, but hopefully I'll present enough that some will resonate with you and help you narrow down your choice. Feel free to grab a pen and paper so you can write down the decision-making points that resonate with you as we go through these criteria. Let's go through some deciding factors that you may want to use when considering Oakton's 16 health career programs. One thing to consider when choosing a health care profession is how much trauma do you want to see? Some professions are more emergency-based or see patients when they are actively sick or injured. There may be trauma, blood, bodily fluids that are part of the treatment process. Or if you see a patient after surgery or illness and they are coming for follow-up care or rehabilitation, you may still see some trauma like angry surgery scars or broken limbs, maybe people with mobility issues or injury or illness, or still actively sick from an illness. But things won't be as fresh as when the patient was first injured or became ill. If your response to seeing trauma or injury or illness of any kind is gross, I never want to see that, then perhaps a healthcare career that is more behind the scenes is for you. Again, all healthcare professionals work together to make people well or stay healthy. However, the level of direct patient care varies. Direct patient care means I am actively present with a sick or injured patient providing some kind of service or treatment. And these include our basic nurse assistant training, medical assistant, nursing, PCT, perioperative nursing, phlebotomy, and our PTA program. Other programs work directly with patients, but in a less clinical way. That is, they are providing a service, an education, or support. And those would include our cannabis dispensary, PCT, and farm tech. Still others are more behind the scenes, doing administrative tasks, and may never actually interact with patients or just have phone or email contact. And those include cancer registry, HIT, medical coding and billing, medical lab tech, public health contact tracer, and sterile processing technician. Something else to consider is how much education do you want, or how long do you want to spend training? Are you looking to spend one semester training because you want to begin work as soon as possible? Can you take a little more time and spend 1 to 3 semesters training? Or is it important to you that you earn an Associate of Applied Science? These programs take 1 semester to complete. 1 semester is about 16 weeks or about 4 months in real time. If you feel you have a little more time, then phlebotomy can be completed in 2 semesters, while medical assistant and medical coding and billing take 3 semesters to complete. In calendar time, that means 1 year to 1.5 years. If you have 2 years or more for training, and if earning a degree is important to you, take a look at cancer registry management, health information technology, medical lab technology, nursing, and physical therapist assistant. Some of Oakton's programs are meant to be added to existing credentials. They assume a specific life situation or that you are 21 years or older. If that's you, then you can consider the programs listed here. It's best to reach out to a health career advisor for more specifics about each of these training programs. I'll go over how to set up an appointment with an advisor at the end of this seminar. Another thing to consider is what time of day can you study? Although subject to change, some programs are offered exclusively during the day or evening, and sometimes there is a choice. So make sure you find out when the classes you're interested in are offered and ask yourself if that will fit into your life. Or can you arrange your schedule to accommodate these classes? Sometimes students want to start with short-term training, but then later build that into another career option. Many of Oakton's programs can lead to credentials and direct employment. Then, with time, experience, and additional coursework, you can expand your career into additional pathways. For example, our Health Information Associate of Applied Science can lead into a bachelor's degree in health information management with additional experience and coursework. The medical assistant certificate can build into the medical coding and billing certificate with 4 additional credentials. And from there, students can gain additional experience and coursework that leads to the HIT Associate of Applied Science, which you know from the previous slide could also lead to a bachelor's degree in health information management. Our PCT certificate could lead to a career in medical assistant or phlebotomy. Most people are familiar with the nursing pathway. Students can begin training as a CNA or a phlebotomist, then build that into a nursing associate of applied science, and eventually a BSN, which stands for Bachelor of Science in Nursing. Again, each step requires additional experience and coursework along the way. This is the phlebotomy pathway, leading to various health careers with academic and professional credentials. And our pharmacy technician program could lead to the PharmD program down the road. And all of our Associate of Applied Science degree programs can lead to advanced degrees in various areas, which you see here, each with additional experience and coursework, of course. Even those of you who may want to eventually go to some type of medical school can choose one of our health career programs, then build that into a bachelor's program, and then eventually a medical school of some type. You would want to work closely with an advisor for this journey, but the point is that it's possible. So we've gone through many points to consider when you're choosing a health career. You may have some ideas about which health careers you'd like to know more about, so what's next? You can use the following online resources to begin reading about the healthcare professions you want to know more about. Each of these sites give you descriptions, training, salary information, and more, so you can continue researching your options. You may also learn more about our programs by going to oakton.edu and search health careers. There you'll find all of our programs listed and an inquiry form to sign up for an information session. Information sessions are a great way to get specifics about a particular program that you're interested in. Our sessions are facilitated by the health career advisor assigned to that program, and it gives you a chance to ask specific questions. Many of the information sessions are online, so they can conveniently fit into your schedule. You may also view pre-recorded videos about many of our programs on YouTube. Simply go to YouTube and search Health Career Programs, Oakton Office of Admissions, and you'll find all of the pre-recorded sessions listed there. And finally, you can email us at healthcareeradvising@oakton.edu. You can use this email address to ask questions, request more information, or even request an appointment with a health career advisor.